Hello, I'm Dr. Deepak Rao, consultant laparoscopic surgeon at the Motherhood Group of Hospitals, Bangalore. A hysterectomy is a surgery where the uterus is to be removed. I have patients who come to me every day who have severe symptoms of bleeding, pain, dysmenorrhea, sometimes bleeding for 10-15 days at a time, and often when they're suggested that they undergo a hysterectomy, they're very wary about it because of these myths. So let us see what are the myths that commonly people associate with a hysterectomy. One of the commonest myths is they feel that they will put on weight and they will attain an early menopause. They do not put on weight with a hysterectomy. A hysterectomy is the removal of the uterus, and it is only when the ovaries are removed that a patient will put on weight. So menopause happens when the ovaries are removed, and that is what causes catastrophic problems for a patient. A second common myth is that hysterectomy needs a long recovery and a lot of bed rest. All women who undergo a laparoscopic hysterectomy are home the next day and back to work within usually between a period of 5 days to about 7 days, at most a week to 10 days. The olden days where an open hysterectomy used to be done and the patient would require bed rest of 6 weeks are long gone. Third myth that patients often feel about a hysterectomy is that it's a very painful surgery, and patients are very comfortable, they're very small cuts, and they're usually able to walk even by evening. Another myth that often puts women off undergoing a hysterectomy surgery is that they feel that they will have a long, ugly scar on the abdomen. Again, a laparoscopic hysterectomy is done with small, minimally invasive cuts, 5 millimeters in length. They heal fast and patients are very comfortable and don't have large scars. Again, oft-repeated complaint that I hear is a lot of women feel that they will lose interest and lose sexual pleasure after hysterectomy. On the contrary, most women enjoy sex more because of 1, the fear of pregnancy is removed, and 2, the basic condition which was keeping them unwell, like a fibroid or endometriosis which was causing pain or bleeding, has been removed, has been eliminated. Again, patients worry about backache after hysterectomy. Again, this is not related to the surgery. It is often due to calcium deficiencies and usually after menopause or when the ovaries have been removed. Some patients come and tell me that their mother or their aunt or someone in their family had a hysterectomy and they were depressed and had mood swings and they became aged, they had bone changes, they had fractures, skin wrinkling. Again, all these are because hysterectomies used to be done with both ovaries being removed, and now if the ovaries are retained, these side effects are not seen at all with just a hysterectomy. Again, often patients tell me that they have delayed the hysterectomy by sometimes 3 to 4 years, and finally when they get the hysterectomy done, they always wish they had done it earlier, because once it has to be done, might as well enjoy symptom-free, pain-free, bleeding-free period for a longer period of time. So what happens to me after a hysterectomy? That's a common question that patients ask. One is, you will be relieved of your symptoms like heavy bleeding, painful periods, etc. The only 2 changes that happen in your body are that you will not have your periods and you will not be able to have a pregnancy. Thank you.